causes of low back pain. 490 million Indians. Yes, you heard me right. 490 million Indians are the population of people who are suffering from low back pain every single year. But do you know that all low back pains are not the same? Yes, you heard me right. There are many reasons due to which low back pain can happen, and this will appear in your body in different ways and different formats. So, what are these causes of low back pain and how you can address them? We are going to discuss all of them in today's video, so let's get started. Friends, low back pain is a very common problem. In fact, the second most common reason why an individual will go to a doctor will be low back pain. Be it small kid, adolescent, elder, or else a middle-aged individual. Be it any age. Nowadays, low back pain has become so common that people experience it and their quality of life and productivity is hampered. Information and understanding about the cause of low back pain can help you to identify it early and act on it early. So, what are these conditions like that will give you low back pain? Let's understand them. The first condition in which the low back pain can impact you is lumbar strain. This is the most commonest form of low back pain where your muscles will get into spasm or strain, and this will give you the symptom of pain. The pain that is experienced in muscle strain is usually localized to your center of the back. It's very intense in nature, sharp in nature, and can impact your mobility. You might find that this pain is more acute in nature, will resolve in 5 to 7 days with the help of basic physiotherapy modalities. This pain, if it is spreading, it will be majorly because of increased stiffness in the muscle or else if your nerve is getting involved. But when your nerve gets involved, then the problem could be something else as well, which needs to be identified. The next condition that gets impacted in low back pain is stress fractures. Yes, you heard me right. Majority of women who have osteoporosis or osteopenia are likely to develop stress fracture in their spine, which gives them low back pain. So, what they need to do in order to get rid of this low back pain is to do regular exercises so that the strain doesn't come on the back. This is very common in women with low calcium, so having a good diet also helps. This problem, which is of stress fracture, can give an intense pain which is followed by a simple fall which will not give otherwise any injury to the back, but if your bones are brittle, then this can give you low back pain. There could be swelling associated with this pain. At the same time, the stiffness and the pain level could be very intense, and immobilization is the solution to get rid of it. That takes me to the third reason of developing low back pain, and that is nerve entrapment or neuropathies. In common words, you would also have heard of this term called as sciatica. Now, in this condition, your sciatic nerve gets entrapped between your muscles, or else sometimes your disc gets herniated, compresses your nerve and give you that radiating pain. This problem usually is unilateral, or else you can say felt on one side of the back, and from there it drops down or passes down towards the leg. These symptoms give you a feeling of pain, like a sharp shooting pain, or sometimes can also give you a feeling of tingling numbness or some sort of heaviness that is present on the limb. Usually, as you get better, the pain will start moving towards the center, which is called as centralization, and that will help you to reduce your pain. The next condition that could be also a reason for your low back pain is called as disc problem or disc herniation. You would have heard this term very commonly called as slipped disc. Now here again, your pain could be centrally located or else could be defined to one side of the area where your disc is getting moved or bulged and compressed. This pain usually is a chronic pain, takes a long period of time to resolve, and sometimes it doesn't resolve 100%. In these scenarios, your disc bulge is the reason for your pain. This pain is more sharp, more deep, and more nagging in nature compared to acute pain. You might also sense that this pain is coming from deeper structures of your area compared to a stiff pain or a strenuous pain which is felt over your muscles. Taking care of your posture, giving adequate support, and doing extension or flexion exercises are the key to address this type of pain. The another reason why anyone can get low back pain is the structural problems that an individual have. Now, we all have heard this, that our posture could be the leading cause of your pain. If your lumbar lordosis or else your curvature of the spine is exaggerated, in that case also, the strain that is going to fall on your lower back is going to be very high, and this is going to impact your lumbar region. This will reduce your pain levels and will cause difficulty in doing your basic movements like bending forward, twisting, turning, etc. Structural problems could be acquired or could be congenital in nature. For example, scoliosis. Yes, scoliosis is a condition in which an individual is born with an S-curve of spine. This can be acquired as well, but majority of time, this curvature is since childhood. And due to this long-term curvature, the pressure that falls on the back muscles is unequal, and that's why there is pain. This condition requires a long-term management, requires a repeated exercises, protocols that needs to be applied on your low back region so that the pain comes under control. Then comes arthritis. Yes, if the disc gets degenerated, at that time also there could be the symptom of pain in lower back. Here the arthritic changes or degenerative changes is the leading cause of it. Unfortunately, once the arthritis starts developing, nothing much can be done. But at the same time, prehab is very crucial here. Taking care of rehabilitation upfront helps an individual to work on prevention of low back pain versus correcting the low back pain. The next condition is called as SI joint dysfunction, which is called as sacroiliac joint dysfunction. Here, the joint which is between your tailbone and your hip bone gets compressed and causes irritation and gives you pain. This condition requires repeated effort, repeated work, and with the help of posture changes and changing in a way of sitting where the pressure on the spine is reducing, that helps an individual to get out of it. The pain, as mentioned, is mostly one-sided, can move towards the legs, but will not go beyond your knee level. That's where the hip structures, the muscles around the leg or thigh also needs to be worked on so that the symptoms come under control. The next problem that could give you low back pain is a disease altogether. So, for example, tuberculosis, tumors, these kind of conditions can also have a severe impact on the spine health and can give you low back pain, which is coming from a different pathological disorder altogether. In this scenario, the pain could be localized to one area or else can spread to other area depending on what kind of disease is causing this pain. For example, as I mentioned, tumors in your spine, tuberculosis of your spine, kidney stones. If you have got a ovarian cyst which is increasing in size, that could also compress your spine and can give you back pain. So, the location of the pain will vary depending on what organ or what disease is affecting it, and this will have an impact on the low back region. And last but not the least, the condition can give you low back pain is spondylolisthesis. Spondylolisthesis is one condition where an vertebrae slip out of its space and can impact the overall spine health. This slipping out of space will irritate the structures, will damage the structures of the spine, the nerves, and will give pain. Again, here the pain in spondylolisthesis will be first more intense in nature, more localized towards the center of the spine over that bony area. But if it is impacting the nerve, then the pain can also radiate to the leg as well. No matter what is the condition that is giving you low back pain, please don't ignore your low back pain. Start working on it by doing a right diagnosis. So make sure to see an orthopedician, a spine specialist, or else your physiotherapist who can identify the cause, the root cause of your low back pain and can help you to work on it. Remember, prevention is better than cure. So make sure to prevent your low back pain on developing itself rather than curing it. Thank you.